Hey folks, Dr. Timothy Harcourt here. We are talking about arthritis and back pain today. And so I'm a chiropractor for 33 years. I practice in Fort Myers on College Parkway 7270. And I'm a third generation chiropractor. So why are we talking to you today? Because I get a lot of patients asking me these questions. Hey, I was given a diagnosis of osteoarthritis. So I guess that's where all my pain's coming from on my back, right? And that's always an interesting question because really there's a very poor correlation between the amount of degenerative change in somebody's spine on their x-ray and their actual pain. So let's talk about what exactly is degenerative arthritis. So, there's over 150 different type of arthritic conditions. The most common ones that everybody kind of thinks of is rheumatoid arthritis. That's the one that grandma or mom has where the fingers are deviated out to the side, the knuckles are red. They might have neck pain with it and everything's kind of red and swollen. That's an aggressive inflammatory arthritis. Osteoarthritis is completely different. It's more or less like a wear and tear type of degeneration. We'll go over the causes of that because it's the most common arthritis. Psoriatic arthritis comes when somebody has psoriasis and attacks their joints. And then erosive osteoarthritis is a kind of a variant. It's like halfway between a rheumatoid arthritis and an osteoarthritis in a way because it can be erosive to the joint. So having said all that, we're going to focus on the big picture here. And most people, when they say arthritis, they're really saying osteoarthritis. Now, osteoarthritis is not an inflammatory arthritis. What causes osteoarthritis or degenerative joint disease? Trauma, like a car accident, sports injury, anything to cause a trauma to the joint where there's a ligamentous laxity. Why would the ligaments be lax? Because they were overstretched and injured. And sometimes they never get their full tensile ability back. And therefore the joint is unstable. And that instability in the joint leads to degenerative change because that instability leads to more pressure on the joint surfaces. And the body's way of fixing that is to tighten it down. So trauma is a big one. So car accidents, auto injuries, any sports injury that causes a significant trauma. These are things that can bring on and accelerate osteoarthritis. If you look at football players, especially professional football players, their knee joints, they might only be 25, 30 years old, but it looks like an 80-year-old's knee. So it speeds up the osteoarthritic degeneration. What else can cause osteoarthritis? If the joint does not move enough, so it's stuck, or we call those rusty hinges. What can cause that? Well, previous macro trauma or additive micro trauma. What do I mean by that? Well, one big accident or multiple small injuries. So we know what one big accident is. It's somebody's in a car accident or a sports injury. But what's additive micro trauma? So additive micro trauma is when there's added pressure over and above what it should be applied to a joint on a continual basis. So what's an example of that? Say somebody's working in a factory and they have to lean forward all day long and put a widget into a motorcycle wheel and they're in a funny position all day long doing that. That could be an example of additive micro trauma. Now what can happen is there can be bleeding into the joint. That blood eventually turns to scar tissue. That scar tissue tightens the joint down, keeps it from moving properly, similar to rust in a hinge. So you pull the pin in the hinge, you sand it, you clean it, you oil it, the hinge is going to work better. A joint in the body that is adhesed or has fibrosis, scar tissue holding it together too tightly, basically we do PV blaster inside the joint. We move it more so that the joint gets better nutrition. So if the joint is not getting proper nutrition because there's a lack of motion, that accelerates osteoarthritis. So let's talk about what you can do to reduce acceleration of osteoarthritis. The short story is we're all going to get it to a certain degree if we live long enough. So how do we reduce osteoarthritic degeneration? So one of the first things that we can do is to make sure that we're keeping ourselves flexible. And one of the best ways to keep yourself flexible is to stretch. And then the next best way is to drink plenty of water so that your tissues have the proper elasticity. When you are chronically dehydrated, your body steals water molecules from your ligaments, tendons, and that reduces flexibility. So make sure you're drinking plenty of water, make sure you stretch, and exercise 30 minutes at least 3 times a week, preferably every day. What is the role of chiropractic in all this? Well, a lot of people know about dental hygiene. Get your teeth cleaned, brush your teeth twice a day, and those are important things, but it's important to keep your back aligned properly, important to keep your back flexible, important to keep the joints moving the way they should. So spinal hygiene is really important. And that takes 2 different types of approaches. One, the active care approach is when somebody really has a significant need. Maybe they're in an accident or an injury. Maybe they've had a chronic problem that really needs some attention. Maybe they're coming in 3 times a week. That's called active care. Maybe they're in pretty good shape and just want to stay that way. And that's called proactive care. That's a couple times a month. Makes a lot of sense. The average person walks between 5 and 10,000 steps a day. So in a month's time, if you just took the lower end, 5 times thirds, 150,000 steps in a month, it kind of makes sense. We're mechanical machines to keep things well lubricated and moving properly and in proper position. Just as much you would want your car alignment on the front end to be proper so that you don't shimmy going down the road and wear the tires out. So another question I get is what causes these rusty hinges besides the fact that there is scar tissue and adhesions holding the joint together. I don't work in a factory, and I'm not a rock climber. So what causes, listen, we're finding that office workers that sit in a chair all day long and don't get up and stretch and exercise, that is almost as detrimental because of the lack of fluidity in the joint. What I mean by that, when joints move, they get nutrition. When they're not moving, they don't get nutrition. So it's really important that you move your joints. And the thing is, when you exercise, if you have rusty hinges, you're not moving that joint the way the adjacent joint is moving because it doesn't have the rusty hinge there, which also puts more pressure on that joint, by the way, because there's asymmetry in the spine. So it's really important to make sure you get your exercises and stretches. People ask, what is the role of proper spinal hygiene when it relates to chiropractic adjustments? Well, a few things. Obviously, you want to back the truck off the garden hose. So if you have a pinched nerve, we get the pressure off of the nerve. The second thing is if you have rusty hinges, we want to get them moving better so that you have better nutrition in your joints. Third thing is to balance the nervous system. A lot of people are over anxious and excited because we live in that society, and especially in this time. So it's really important to balance the nervous system, and there's multiple ways that can be done. Can be done through spinal adjustments. It can be done through meditation. It can be done through yoga. It can be done through positive affirmations. It can be done by a lot of different things, but spinal manipulation definitely helps that. And research shows that when you get adjustments to the neck, it helps to stimulate the alpha waves of the brain, and that helps you get into better REM sleep. So the better we sleep, the better we feel the next day because we got better cellular support and replication. So those are important things. And then regular adjustments provide an improvement in immunity. Research has shown that white blood cells are released directly after a manipulation. So my personal experience is my grandfather, father, 2 brothers, myself, chiropractors. I'm also a neuromusculoskeletal medicine doc. That when patients get regular adjustments, maybe they're getting 2 adjustments a month, they typically get sick less because they're keeping after their not only their nervous system balance, but also their immunity. Also, we have an opportunity to make sure we're taking care of things before they become a big problem. People ask, how can I reduce, if they know they have osteoarthritis, how can I reduce that, or what can I do to limit the progression of that? So in addition to the exercising 30 minutes a day and staying flexible, you need the raw materials. So make sure you're eating well. And I don't mean a lot. I just mean good raw materials. So fresh vegetables and fruits are really important. You definitely need a protein source. It doesn't necessarily have to be meat, but sure shouldn't be an overabundance of red meat, but make sure you mix that up. We live in an area where there's seafood available, and that's excellent. And of course, avoid traumatic activities. You might ask, well, what would that be? Well, mixed martial arts probably isn't the best thing to reduce the chance of osteoarthritic degeneration in the spine. Football, high contact football isn't the best thing. We already talked about what happens to the knees. Boxing, not so good for the head either. Certainly not good for the neck. So there's a lot of different things that you might want to avoid there. I was watching the other night a fellow doing a flip 77 feet down a canyon cliff on a bike. And I got to thinking, anything goes wrong with that, that's pretty much a done deal. So I would kind of avoid those things as well. Also, if you get regular adjustments twice a month, it'll help keep your joints moving in the right way. I do get the question, can taking calcium supplements cause bone spurring in my back? The answer is no. I mean, those bone spurs are made up of calcium, magnesium, and phosphorus, but it's not because you had them in your supplements. It's because there was an inflammatory process around the ligaments of the spine, and the body's way to contain that is to stabilize it and lay down bone in that inflammatory process area of the ligament. That's called a bone spur. That had nothing to do with how much calcium you brought into your body. It's a good question, though. I mean, it's kind of logical. If I take too many of these, am I going to get spurs all over my back? The answer is no. And by the way, in the gut, if you're taking too much calcium in, there's a channel block so that your body just basically doesn't absorb it. So, it's important to have vitamin D along with that too to make the absorption occur. So how can I find a great chiropractor in my area? Patients, we have a lot of snowbirds here, and maybe they live here for part of the year and then they go up north and they would like a chiropractor up there. I recommend people go on the IANM website, International Academy of Neuromusculoskeletal Medicine. The link will be attached to this video. And you can put your zip code in and find out a board-certified doc in your area. Is there any correlation between osteoarthritis and fibromyalgia? In other words, does fibromyalgia cause osteoarthritis, or does osteoarthritis cause fibromyalgia? It's basically unknown. We don't know that there's any significant correlation, but fibromyalgia is a very painful condition, so anything that's a comorbidity to it that limits motion isn't a good thing because the muscles are already irritated. So think of it this way. If you have 3 rusty hinges on a door and it takes more energy to move the door because the friction's higher inside those hinges from the rust, it's going to put more pressure on the muscle moving the door. Well, it's the same way in your spine. If you have a lot of osteoarthritis, it takes more muscular strength to move that joint because it's essentially a rusty hinge. So it can help, we'll put it that way. But as far as we know, it's unknown about the correlation. Can physiotherapy be beneficial for settling down osteoarthritis or fibromyalgia? The answer is yes. Will it cure those two things? No, it'll help settle it down, though. And there is a degree of, satisfaction with that because sometimes that's all it really takes. So what I mean by that, we have patients coming in that might show on an x-ray absolutely no degenerative change in their spine at all. They look like it's like a 12-year-old's neck or back, but they have severe pain. And then you get the next patient coming in that has severe degenerative change and has zero pain, never had any pain their whole life in their neck or the back. There's almost no correlation between the amount of degenerative change in the back and their actual pain level. We do know that function levels have a lot of correlation, though. So if you're able to keep your function level high, you're exercising, you're stretching, you're eating properly, you're drinking plenty of water, you have good positive affirmations, you're moving your health forward all the time, looking at videos like this. And by the way, if you have any suggestions for further videos, we'd love to hear it. We're here to help you. We hope these do-it-yourself videos are helpful for you. We're just here trying to help move your health forward. So we hope that you live healthy, live strong, and remember to always live creative. It's Dr. Harcourt signing off. Had a great day. Know you need to go in a different direction? Call and we'll have a sit-down, no-charge consultation.
Thank you so much for watching. Please remember to like this video and subscribe to our YouTube channel. Also, check us out on Facebook and Instagram. Links are down below.